Alright YouTube, this is Dominic Bright coming at you again. What we're going to be discussing today is going to be the bariatric process. So if you are contemplating on having this surgery, this is going to be the steps that you're going to need to go through. So stay tuned because we're going to be discussing it next. When it comes to making any decision, you have to weigh out the options, especially when it comes to the bariatric surgery. Reason being is because it is a life and death matter. It is a major surgery that is going to have to take place. The first thing that you need to know is this is not a magic pill. It does require hard work, dedication to get through the whole process. Not just talking about the day of the surgery, the pre-surgery, after the surgery, the whole lifestyle change takes hard work because it's something that we need to get used to, because we wouldn't be thinking of this situation if we didn't put ourselves slightly into this situation. Now there are other factors that does come up that puts us in these situations, but the first thing that we are going to have to do is realize that this is a tool. So with any tool, if it's not utilized, it's just a tool. It's just sitting there. It's a toolbox. It's just sitting there. It's collecting dust. We need to utilize this tool to become healthier, and which will then lead to a happier and also a better quality of life, not only for us but also for our family. That's the first thing that needs to happen, is the realization of what this is. This is a tool. It's to help us save our lives in most cases, because when it comes to contemplating and having the bariatric surgery, 100% of the time is going to be for medical issues. For instance, myself, I was going through quite a few medical issues. The first thing that struck me was my hypertension. So after hypertension, what came next was blood clots. I was getting blood clots in both my legs. After that, I started to develop sleep apnea. I was having trouble sleeping at night. Went and got a sleep study done, and I ended up with sleep apnea. There are other issues that does come up: diabetes, heart failure, lung disease. Anything that deals with your obesity is the reasoning to have the surgery. Now, it does rectify a lot of this right at the beginning, but like I said, it is a tool. The first step that you have to take is going to be to contact your doctor, your insurance company, and your local hospital, wherever you're going to be having it at, or your doctor's affiliate. What that's going to trigger is, first off, make sure it is approved, otherwise you're going to be paying out of pocket. Next, what it will trigger is the start of the process on paper. And what I mean by that is you have to get approved for the surgery, especially dealing with insurance companies. So you have to get approved. It's like any loan or any type of mortgage, anything like that. It has to be approved by the insurance company. So what's going to happen is you're going to have to do anywhere from 6 to 12 months of medical weight management. Medical weight management is going into your local hospital or your local primary care doctor to get weighed. Now, I personally went through the hospital itself. That gave a little bit more information, and it also gave me access to a nutritionist. So anytime I went in for my weigh-in, not only was it a weigh-in, it was also a bit of psychological, and it was also informational, because you were dealing with the nutrition. So they would ask you, how was it going this month? What were some of the issues that you were having? And then they will give you some tips and tricks on how to get through that. That is actually the easy part, going to get weighed in. The hardest thing, like anything with advice, is implementing it. So implement the tools that they're giving you, because it is going to be helpful not only now but also after the surgery and the rest of your life. So once you start going through this process is when it's going to start hitting home. So once you get through the 6 months, in my case, I actually had to lose a certain amount of weight. I was weighing 555 pounds when I made the decision to move forward with it. So I had to lose 55 pounds to even be considered at the hospital. Reason being is because most medical equipment only holds up to 500 pounds, so I had to get under that in case of any emergencies or anything of that nature. Once I lost all that weight, it actually did take me 7 months to complete, even though the minimum was 6, but I had to get under that weight. Once that's done, they'll send your paperwork out to your insurance company. Once that's completed, you will then get a surgery date. So generally the surgery date is roughly 3 weeks out. Reason being is because you have to start preparing, and preparing not only mentally but also nutritionally, because you actually need to start your liquid diet 2 weeks before you have the surgery. What the liquid diet is doing is actually shrinking down your liver, so when they go in laparoscopic surgery, it will be shrunken down so they don't have to go around or move anything. It just makes it a whole lot easier for the doctor. So once they said it's going to give them an easier job, I was like, yes, I will start this, because this is also a preamble to what's going to happen next after the surgery, once you wake up. So after you do the 2 weeks, there are some slight things that have to happen the night before. For instance, what I had to do, I actually had to drink 1 Gatorade before I went to bed, and then 1 Gatorade once I woke up the day of the surgery. The reason that is because you are going to be going through a lot of havoc on your body. Not only just a surgery, but you're also going to be dehydrated, but they hook you up to an IV. But you want to make sure, they want to make sure that you have enough electrolytes before doing the fasting, and then also have your body prepared with the sugar in it as well, in the Gatorade. So the day of the surgery, you go in, all you have to do is show up. Once you show up, it's game on at that point. All your hard work is starting to become fruitful. And what happens next, after you wake up, you're not going to feel so great. When you wake up, when I woke up, I wasn't in much pain. I just wanted to sleep. I just wanted to sleep. They give you morphine to help with any pain, but I just wanted to sleep. I guarantee you, when you get up, you will not be hungry. You will have a little discomfort. In my case, that's all I had, was just a little discomfort. The one problem that I did have coming out of surgery, pretty normal, because they are cutting your stomach, so you are going to have a little bit of blood that does come up. The hardest thing to do while in the hospital is you have to drink 12 ounces. People I know, especially myself, that was one of the hardest things to do, because you're not hungry. You don't want to intake anything, because you basically have a baby stomach. You basically have a whole new stomach, and you don't want anything. You don't want anything in your body. It was the hardest thing, throwing back 12 shots, or 1 shot basically an hour, and you're only sipping on it, and it is water. And it was rough. It was rough. I only had to stay in a day. If I wasn't able to get the 12 ounces down, they would have made me stay another day. But since I was able to get the 12 ounces down, they did release me. So once they release you, you're still on a clear diet, not even liquid, just clear. So broth, little bit of Jello, but for me it was mainly just staying hydrated. You're not hungry, you're not really thirsty, but you have to stay hydrated, because one thing, you're coming out of surgery and now you don't have an IV anymore, so you have to stay hydrated. So that's the hardest thing. You have to basically make yourself drink. When you just start, you don't want a thick protein shake, because your new stomach isn't used to anything yet, so you're introducing it, but you don't want it to be too thick. You want to try and keep it as thin as possible. One thing I did, I actually got medical grade protein, and I actually put it either in water or Powerade. Reason being is it was a lot thinner and it was easier for me to intake. The other thing I actually started doing was putting it in branched chain aminos, and that actually helped as well. So once that's done, you actually go to a soft diet. You start having maybe like creamier broths, and you can have hard-boiled eggs, even lightly scrambled eggs. They want to start introducing stuff a little slower. And then after that, they pretty much say you're on a regular diet. Try and keep it between 12 and 1,400 calories, because they know you have to make yourself eat because you're not hungry. You want to give yourself enough intake to fuel you for the day. That was one thing that I dealt with a lot, because I don't know if it was because I was so big, but I was dealing with a lot of fatigue. I was tired, but I think the reason was when I was eating, it wasn't enough. And that's one advice I can give you is try and get as much as you can in. I was sticking more on the shakes. I wasn't introducing much because I would get sick. The other thing that was harming me is I come from an Italian family. So when you come from an Italian family, not only do you eat a lot, but you also eat fast. And that's one of the things I'm actually still dealing with, is slowing down. You have to slow down, because it's at least allowing a little digestion. Before, you used to just be shoveling it in, and now you have to give it time. You have to do 30 chews. So that's the hardest thing. But after the restricted diet, it's pretty much on you. You know the guidelines that you kind of have to go off of, but it's more mental afterwards. So afterwards, you start losing weight. For me, I was in like levels. So I would drop a whole bunch of weight, and then I really wouldn't see anything, but I would notice my body shrinking, and then I would lose a whole bunch of weight, and then same thing. And then eventually where I'm at now, I started to plateau. We'll get in a little bit more into that. But the whole point of this video is to just give you an idea on what you're going to have to go through. So like I said, you're going to be dealing with a lot of struggles through it, but I just wanted to give you a complete overview of the steps that are needed and the process of having the bariatric surgery. Keep an eye on the channel. I'm going to be bringing you a lot more information. Post any comments that you have down below or questions. Like I said, I'm here to help. Help me help you. If you have any advice for myself, I did give you a little bit of information on what I'm still going through, especially with struggles that I'm having now being 2 years out. Stay tuned to the channel, subscribe, got more videos coming at you.